A 76-year-old man walked into his daughter's kitchen one morning and said something that would haunt her for years. "I just don't feel right anymore," he told her. "Something's different." She brushed it off, told him he was just having a bad day. But 6 months later, he was gone. And looking back, she realized he had shown all 5 of the warning signs I'm about to share with you today. If you or someone you love is over 70, I need you to pay very close attention to what I'm about to tell you, because these subtle changes in your body could mean you have less than 6 months to live. And most people, most families, they miss these signs completely. Doctors and hospice nurses see these patterns every single day, but they rarely talk about them. Today, I'm going to share what medical professionals notice in the final months of life. This information could save your life, or at least help you prepare for what's coming. Now, before we dive in, I want to be completely honest with you. This isn't going to be an easy conversation, but it's one we need to have. Most doctors won't tell you this. They don't want to scare you. They don't want to take away your hope. But you deserve to know the truth. You deserve to recognize these signs so you can make the most of the time you have left, get your affairs in order, and spend meaningful time with the people you love. I've spent years researching end-of-life care, talking to hospice nurses and studying medical literature. And what I've learned is that the human body gives us warnings, subtle, quiet warnings that most people dismiss as just getting older. But these aren't normal aging. These are your body's way of telling you that major systems are beginning to shut down. And if you know what to look for, you'll have time. Time to say what needs to be said. Time to do what needs to be done. Time to prepare. So let's get into it. Here are the 5 things that happen in the 6 months before death that doctors and nurses recognize immediately. The first sign is a sudden and significant loss of interest in food. Now, I'm not talking about losing your appetite for a day or two when you have a cold. I'm talking about a profound disinterest in eating that lasts for weeks or months. The 76-year-old man I mentioned earlier, his daughter noticed he stopped asking about dinner. He used to love her pot roast, would ask about it every Sunday. But suddenly, he'd take 2 bites and push his plate away. "I'm just not hungry anymore," he'd say. Here's what's happening inside your body. When your organs begin to fail, especially your kidneys and liver, your body produces toxins that suppress your appetite. Your digestive system slows down dramatically because your body is redirecting energy away from digestion and toward keeping your heart and lungs functioning. Hospice nurses call this actively dying, and loss of appetite is one of the earliest signs. Your body knows. It knows that it doesn't need as much fuel anymore because it's preparing to shut down. Now, here's what makes this particularly important to recognize. If you or someone you love suddenly loses interest in their favorite foods they've eaten their whole life, and this continues for more than 2 weeks, you need to see a doctor immediately. Get a full blood panel done. Check kidney function, liver function, and electrolyte levels. Because sometimes, caught early enough, this can be reversed. Maybe it's a medication causing the problem. Maybe it's dehydration. Maybe it's a treatable infection, but you won't know unless you get checked. And if it turns out to be something more serious, if organs are failing, you need to know. Because this is when you have important conversations. This is when you ask about their wishes. This is when you make sure everything is in order. Don't wait until they're sleeping 22 hours a day and barely responsive. By then, it's too late for those conversations. The third sign is excessive sleeping, and I mean really excessive. We're talking about sleeping 14, 16, sometimes 18 hours a day. Now, as we age, yes, we need more rest. That's normal. But there's a difference between needing an afternoon nap
and sleeping most of the day away. One hospice nurse told me a story that stuck with me. She had a patient, an 82-year-old woman who was sharp as a tack, loved doing crossword puzzles, watching game shows, chatting with visitors. Then over the course of about 3 weeks, she started sleeping more and more. First, she'd doze off during her favorite TV show. Then she started napping twice a day. Then she was sleeping 20 hours a day, barely waking up for meals. 6 weeks later, she passed away peacefully in her sleep. Here's what's happening. As your body's organs begin to fail, they're not processing toxins the way they should. These toxins build up in your bloodstream and make you feel incredibly tired. It's not regular tiredness, it's a deep, overwhelming fatigue that sleep doesn't fix. Your body is also conserving energy. When your heart is weak, when your kidneys are failing, when your liver isn't functioning properly, your body says we need to preserve every bit of energy we have. And the best way to do that is through sleep. This is also your body's natural way of easing you toward death. Sleep is peaceful. It's painless. And as you sleep more and more, you become less aware of discomfort, less aware of what's happening. Now here's what you need to watch for. If someone you love is suddenly sleeping significantly more than usual, and I mean a dramatic increase over a few weeks, and they seem disoriented or confused when they wake up, this is a major red flag. Take them to a doctor. It could be a medication interaction, it could be low oxygen levels, it could be a urinary tract infection, which in seniors can cause extreme fatigue and confusion. These things can be treated. But if it's something more serious, if organs are failing, you need to know. Because this is when you have important conversations. This is when you ask about their wishes. This is when you make sure everything is in order. Don't wait until they're sleeping 22 hours a day and barely responsive. By then, it's too late for those conversations. The third sign is social withdrawal. And this one is heartbreaking because it's so easy to misinterpret. People who are within 6 months of dying often start pulling away from friends and family. They stop calling people back. They don't want visitors anymore. They cancel plans. They seem distant, even with people they love. Families often take this personally. Why doesn't Dad want to see me anymore? Did I do something wrong? Is he mad at me? But it's not about you. It's about what's happening inside them. There's actually a psychological and physiological reason for this. Psychologically, as people approach death, they're beginning what's called life review. They're processing their entire life, making peace with things, letting go of attachments. And to do that, they need solitude, they need quiet, they need time alone with their thoughts. Physiologically, social interaction requires energy. Talking, listening, responding, it all takes effort. And when your body is failing, you don't have that energy to spare. Even a 20-minute conversation can feel exhausting. I talked to a woman whose father stopped coming to Sunday family dinners. For 40 years, he never missed one. Then suddenly, he'd make excuses. Too tired, not feeling well, maybe next week. She was hurt. She thought he didn't want to see the family anymore. But looking back, she realized he was showing this sign. He was withdrawing, pulling inward, preparing. He passed away 4 months later. Here's what you need to understand. If someone who has always been social suddenly becomes reclusive, don't just accept it. Don't say, "Oh, that's just how old people are." That's not true. Visit them anyway. Sit with them quietly. You don't have to force conversation, just be present. Hold their hand. Let them know you're there. And pay attention to other signs. Are they breathing different? Are they losing weight? Are they sleeping more? Because social withdrawal combined with other symptoms means something serious is happening. This is also the time to say the things that need to be said. Don't wait for the right moment. The right moment is now. Tell them you love them. Thank them for what they've done for you. Ask them about their life. Record their voice. Take photos. Make memories while you still can.
The fourth sign is something most people don't even notice. It's changes in body temperature regulation. People who are approaching death often complain about being cold all the time, even in warm rooms. They wear sweaters in the summer. They pile on blankets. Their hands and feet feel ice cold to the touch. Then, sometimes, they'll suddenly feel too hot. They'll throw off all the blankets, complain about the heat, sweat profusely. This back and forth, this inability to regulate temperature, is a major sign that the body is failing. Here's why this happens. Your circulatory system is weakening. Your heart isn't pumping blood efficiently to your extremities. That's why hands and feet get cold first. Blood is being redirected to vital organs, your heart, your lungs, your brain, trying to keep them functioning as long as possible. Your body's thermostat, which is controlled by your hypothalamus in the brain, also starts malfunctioning. It can't maintain your core temperature the way it used to, so you swing between feeling freezing cold and burning hot. Hospice nurses are trained to recognize this. They'll feel a patient's hands and feet. If they're cold and clammy, if there's a bluish tint to the skin, they know circulation is failing. They know time is limited. One nurse told me, "When I see purple or blue fingertips and toes, I know we're probably looking at days to weeks, not months." Now, if you or someone you love is experiencing this, here's what you need to do. First, see a doctor. Get your circulation checked. Get your heart function checked. Sometimes this can be improved with medication, with compression socks, with physical therapy. But if it's a sign of overall decline, you need to keep them comfortable. Warm blankets, warm socks. Keep the room temperature comfortable for them, not for you. Don't argue with them when they say they're cold. They are cold. Their body is telling them something is wrong. And watch for other signs. Cold extremities combined with confusion, with decreased appetite, with increased sleeping. This combination means you're looking at the final months. The fifth and final sign is one that actually gives families false hope. It's called terminal lucidity, or the rally. And it's one of the most common things that happens in the final weeks before death. Here's what it looks like. Someone who has been declining for months, maybe even bedridden, barely responsive, suddenly has a day or two where they seem completely fine. They wake up alert, they want to eat, they want to talk, they're laughing, telling stories, acting like their old self. Families think, "Oh, thank God, they're getting better. They've turned a corner." But experienced hospice workers know the truth. This rally is usually a sign that death is coming within days, sometimes within hours. Why does this happen? Medical science doesn't completely understand it. Some theories suggest that the body releases a final surge of adrenaline and endorphins. Others believe that the brain, sensing the end is near, gives one last push of energy so the person can say goodbye. I've heard countless stories of this. A grandmother who hadn't spoken in weeks suddenly calls each of her grandchildren by name, tells them she loves them, gives them specific advice. The next morning, she's gone. An elderly man who'd been unconscious for days suddenly sits up, asks for his favorite meal, eats every bite, talks about his life, and then peacefully passes away that night. This rally can last a few hours or a few days, but it's almost always followed by a rapid decline. If you witness this, cherish it. Don't waste it thinking everything is fine now. Use this time to say goodbye. Ask questions. Listen to their stories. Record their voice. Tell them it's okay to let go. Because this is often the last meaningful conversation you'll ever have with them. Hospice nurses will tell you, when we see the rally, we call the family. They tell them to come now, not tomorrow, not next week, now. Don't miss this window. So, those are the 5 signs. Let me recap them for you. Number 1, sudden and significant loss of appetite. Number 2, sleeping excessively, 14 hours a day or more. Number 3, social withdrawal and isolation. Number 4, inability to regulate body temperature. And number 5, an unexpected rally or moment of clarity. Now, here's what I want you to do with this information. First, don't panic if you see one of these signs in yourself or someone you love. Anyone alone could be something else. Could be medication, could be depression, could be a treatable condition. But if you see multiple signs happening together over a period of weeks, you need to act. Get to a doctor, get a full evaluation, find out what's really going on. And if it turns out that someone you love is in their final months, don't waste that time. Have the hard conversations. Ask about their wishes. Make sure legal documents are in order. Spend time with them. Say what's needed to be said. Because here's the truth that nobody wants to hear. We're all going to die. Every single one of us. And the only question is whether we'll be prepared when that time comes. Knowing these signs doesn't make death easier, but it does give you time. Time to love, time to prepare, time to say goodbye properly. If this video helped you, please share it with someone who needs to see it. Leave a comment below telling me which sign surprised you most. And if you've experienced any of these with a loved one, I'd love to hear your story. Thank you for watching. Take care of yourself and take care of the people you love.